Chair, I'm ready.
Call to order Health, Education, and Welfare Committee agenda, December 8th, 2021. The time is now 1:30. I'd like to ask Representative Marshall to please give the invocation.
Let us pray. Creator God, we just thank you for this opportunity of coming together to take care of the business of the nation. And we just ask that you continue to lead and guide us in all the decisions that we make this day. And we just want to thank you for all the blessings that you bestow upon us each and every day. And we just ask that we just come to you this day with grateful and thankful hearts. And we just ask all these things in your holy and precious name. Amen.
Amen.
Roll call, Tracy Wade.
Mary Crawford,
Present.
Joyce Deere,
Present.
James Jennings,
Here.
Anna Marshall,
Present.
Lucian Tiger.
Present.
Chair, you have 5 present and 0 absent.
5 present, 0 absent, constitutes a quorum. All business conducted will be official. Next item on the agenda will be the approval of minutes from 11/10/21 and 11/20/21.
Mr. Chair, this is Representative Marshall. I make a motion that we approve the minutes with any necessary changes.
Representative Marshall made a motion to approve the minutes with any necessary changes. Is there a second?
Second.
Second by Representative Deere. Discussion? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deere,
Yes.
James Jennings.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda will be the order of business. A tribe resolution of the Musco Creek Nation, TR 12-161. A tribe resolution of the Musco Creek Nation authorizing principal chief to execute a certain agreement between the Musco Creek Nation Department of Health and Tier Point LLC on behalf of the Musco Creek Nation Department of Health. Sponsors Representative Jennings.
Chairman, motion for due pass.
Representative Jennings made a motion for due pass. Is there a second?
Second.
Second by Representative Deere. Discussion. Representative Jennings.
Yes. Mr. Terry?
Thank you, Mr. Jennings. This piece of software, which is TierPoint, it's a master service agreement for offsite disaster recovery for networks and systems. TierPoint, they offer a kind of a customized product that we're going to be using for data applications and infrastructure. And what it's really going to do is that it's going to help us minimize those unexpected interruptions that we have when our network goes down. So that's really what this is for. And I'm happy to answer any questions if you have any.
Questions from the committee for Secretary Terry?
Mr. Terry, James Jennings. So is this agreement already in place?
Yes, sir. These things go from year to year, and this is, I believe, one that we're just renewing for this next year.
Thank you, sir.
Any more questions from the committee for Secretary Terry? Questions from council on the line for Secretary Terry? Hearing none, roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deere.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda is TR 21-162. A tribe resolution of the Muscogee Creek Nation confirming the nomination of Lucinda Myers to serve on the Muscogee Creek Nation Election Board. Sponsors Representative Marshall.
A motion for due pass.
Representative Marshall made a motion for a due pass.
Second.
Second by Representative Crawford. Discussion. Representative Marshall.
Yes. Is there anyone from the election board on the line? If not, I make a motion for a due pass because Mrs. Myers is committed to the business of the election board, and I think she would make a very good candidate for nomination.
Thank you, Representative Marshall. With that being said, with no objections from the sponsor, I'd like to be out as a co-sponsor, please.
No objection.
Thank you, Representative Marshall. Any discussion from the committee?
Where's Ms. Myers, Chairman?
I
don't-
did,
Chief Hill, you? Go ahead.
I
Representative
did
Marshall?
send her email and she did accept it.
I spoke with Ms. Myers yesterday, and she said that because I asked her if she was going to be on the call, and she said that she didn't know that she was supposed to be.
Thank you. Thank you, Chairman.
Representative Jennings, this passes. We'll make sure that she is at pre-agenda for an interview.
And
Is that okay with the
I
committee?
will- and I will also let her know as well.
Thank you, Representative Marshall. Any other discussion from the committee? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, NCA 21-139. A law of the Muscogee Creek Nation authorizing expenditure of grant funds awarded from the District Attorney's Council for the benefit of the Family Violence Prevention Program. Sponsors Representative Marshall.
A motion for due pass.
Representative Marshall made a motion for a due pass. Is there a second?
Second.
Second by Representative Deer. Discussion. Representative Marshall.
Is Mrs. Partridge on the line? Yes, she is.
Yes, hello, Representative Marshall and Chair Committee. Partridge. Can you guys hear me okay?
Yeah, that's right.
Nope. Can you hear me?
Yes. But
Okay.
Somebody's got some background noise.
Some background noise. There's not anybody else in my office, so
Ms. Partridge, could you hold one moment, please? Anyone
yes.
that's on the call that's not speaking right now, could you please mute your device? Thank you. Go ahead, Ms. Partridge.
Yes, thank you. So this VOCA grant is an award that we've been receiving. It's a competitive award. We've been applying and receiving this funding since 2015. So I'm happy to answer any questions regarding this grant.
Ms. Partridge, this is Ann Marshall.
Yes.
Is this going to be more for training your staff, or is there going to be some services involved?
Yes, so no, this grant is for direct services. It does, over the years since 2015, this grant has been reduced just because of reductions in VOCA funding that's provided to the state. This grant is administered through the state. So this funds a full-time advocate that we've had on staff since 2015. It also is going to fund a portion of the salary for the SANE program manager through health. And it will also provide direct assistance. It includes a small amount, but $3,500 to help assist victims of crime. So.
Okay, thank you.
You're welcome.
Any questions from the committee for Ms. Partridge? Any questions from council on the line for Ms. Partridge? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. NCA 21-140. A law of the Muscogee Creek Nation authorizing expenditure of grant funds awarded from the U.S. Department of Justice Office on Violence Against Women for the benefit of the Family Violence Prevention Program. Sponsors Representative Marshall.
Motion for due pass.
Representative Marshall made a motion for due pass. There's a second.
Second.
Second by Representative Deer. Discussion. Representative Marshall.
Ms. Partridge,
Yes.
any comments on this particular grant?
Yes, thank you, Representative Marshall. So this is our Tribal Sexual Assault Services Program grant. It's a 3-year grant. This will be the 3rd time we've received it. First time being back in 2014. These funds will not start until next October because we have an extension on the existing grant. I'm not sure if a budget was attached to this legislation. The award ceiling was $375, and so that's the budget that we completed. However, the Office on Violence Against Women actually ended up funding us for $450,000. We have not made those changes to that budget yet, however, because we will have to work with OVW officials and with guidance from them on how they would like or where they would like to see us allocate those remaining funds. But this funds one staff member in direct assistance specifically for working with child victims of sexual violence and their families. And happy to answer any questions that anyone may have.
Thank you, Ms. Partridge. Question from the committee for Ms. Partridge? Questions from council on the line for Ms. Partridge? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. NCA 21-141. A law of the Muscogee Creek Nation authorizing expenditure of grant funds awarded from the U.S. Department of Justice Office on Violence Against Women for the benefit of the Family Violence Prevention Program. Sponsored Representative Marshall.
A motion for due pass.
Representative Marshall made a motion for a due pass.
Second.
Second by Representative Jennings. Discussion. Representative Marshall.
Ms. Partridge?
Yes, so this is the Grants to Indian Tribal Governments program. Our program has had this grant since I think the early to mid 2000s. This is also a 3-year grant, competitive. And with this grant, we primarily fund legal assistance for victims of domestic violence, sexual assault, dating violence, and stalking. And so this funds a project coordinator, an advocate, and then we also will use it to help fund contractual work with attorneys. Right now, we have a contract in place with Legal Assistance of Oklahoma that provides a full-time attorney, again, to represent victims and protective orders and those types of hearings. So, and again, happy to answer any questions. Thank you.
Ms. Partridge?
Yes.
Representative Deer.
Thank you, sir. When is the contract period? When did it start?
So we started the LASSO, or the agreement with LASSO has been in place, I believe, since 2018. And so we are still under right now this particular grant that you're approved, that you would look to approve today, would not go into effect until April because we have an extension the current grant award.
Does that need to be changed on the contract? It says October 1.
Well, so, and that would really be up to the council. Technically, the project period for this particular grant for the FY 22 would be October 1, but since we have an extension on our existing award, our project date would not be until April. Now, there is the potential that if we were to wrap up goals and objectives on our current award sooner than April, then we could request to end the current award and start this new one sooner. So.
But if it starts in April, it'll go for a full year.
This will actually be 3 years. And sometimes, again, with these grant programs, again, depending on a variety of things, again, here, we have this extension, a lot of it in part due to the pandemic. So there, because we weren't in court or providing a lot of legal assistance during that time, there were excess funds. And so So yes, but these are 3-year projects. If there are additional goals and objectives to complete, then they generally approve us for extensions.
Okay, thank you.
You're welcome. Thank you.
Any other questions of committee for Ms. Partridge? Questions from council on the line for Ms. Partridge? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer,
Yes,
James Jennings.
Yes.
Chairman, you have 4 in favor, 0 against.
4-2, a law of the Muscogee Creek Nation authorizing the expenditure of the U.S. Department of Justice Coordinated Tribal Assistance Solicitation Purpose Area 6 Children's Justice Act Partnerships for Indian Communities Grant Funds for the benefit of the Muscogee Creek Nation Children and Family Service Administration. Sponsors Representative Marshall.
Motion for due pass.
Representative Marshall made a motion for a due pass. Is there a second?
Second.
Second by Representative Crawford. Discussion. Representative Marshall.
Is Mrs. Carman on?
Hi, yes, good afternoon. This is Miranda. Good afternoon, committee.
Would you like to address anything in this legislation?
Yes, so this is a new grant that we've received. It is a 3-year grant. We've had this grant before, and we've primarily used these funds to support our child protection services staff. So our investigators that go out on child abuse and neglect cases, this funding would support those positions.
So basically, on your budget worksheet, so the positions that you have under personnel would be it's going to be salary support for the ones you just mentioned for current staff?
I believe that it's 1 current staff, and then we would need to hire an additional staff member. But there would be at least 2, if not 3 full-time positions with that funding.
Oh, okay. So you're basically including the current staff and then you're going to add 2 additional.
Yes, so we do have a current staff that was covered under the prior grant, and so we will continue to utilize those funds for her salary.
Oh, okay. Okay, thank you.
You're welcome.
Thank you, Representative Marshall. Questions to the committee for Ms. Carman? Questions from council on the line for Ms. Carman? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer,
yes,
James Jennings.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, NCA 21-143. A law of the Muscogee Creek Nation authorizing the expenditure of the American Indian College Fund Native Pathways to College 2021-2022 Higher Pathways Grant for the benefit of the youth services. Sponsored Representative Jennings.
Motion for a due pass.
Representative Jennings made a motion for a due pass. Is there a second?
second,
Second by Representative Deer. Discussion. Representative Jennings.
Thank you. Mrs. Mason?
Yes, sir. Good afternoon. This is the second time we received this grant. The American Indian College Fund actually reached out to us a couple of years ago and asked us to apply. It's just a small $3,000 grant, but what we're able to do with it is to provide some supportive services to young people who are preparing for college. Currently, we're hosting a series of workshops based on the students' attendance. At those workshops, they'll receive different incentives just for coming, so like gift cards, t-shirts, things like that. But then also they'll be eligible after they've attended 3 workshops to get assistance with ACT or college application fees. And we'll be referring them over to the new ACT service that the Department of Education does have. So we'll be able to utilize that funding to help those students in the best way. If there's any other questions?
So you have a current staff that will be doing this?
That's me, yes.
Okay. Okay, thank you.
Any more questions from the committee for Ms. Mason? Questions from council on the line? Hearing none, roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. NCA 21-144. A law of the Muscogee Creek Nation authorizing expenditure of grant funds awarded from a Project Echo grant for the Muscogee Creek Nation Department of Health.
Motion for due pass.
Sponsors Representative Jennings, motion for due pass by Representative Jennings, seconded by
Second.
Representative Deer. Discussion, Representative Jennings.
Mr. Terry,
Thank you, Mr. Jennings. The ECHO grant is a nursing home grant that was an agreement between the University of New Mexico and skilled nursing facilities. It's essentially a 16-week virtual learning curriculum that we sent to people through this course. And it's all done online. I believe that we're pretty much through this stuff. And once we receive authorization to spend that money, we'll just reclassify the expense of that training over to this grant. But I'll be happy to answer any questions.
Questions from the committee for Secretary Terry?
This is Ann Marshall. Mr. Cherry, I have a question. So is this a nursing home or it's a program?
Well, if you look at our physical rehabilitation hospital, PRC, part of that has a skilled nursing unit inside there, which is technically a nursing home. And so that's why we would receive this money for some kind of nursing home education. So that's what it's for.
Okay, thank you.
Thank you, Representative Marshall. Questions from the committee for Secretary Terry? Questions from council on the line for Secretary Terry? Hearing none, roll call vote, please.
James Jennings.
yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Deer.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, NCA 21-146. A law of the Muscogee Creek Nation authorizing the expenditure of grant funds awarded from the United States Department of Health and Human Services Administration for children and families for the benefit of the Muscogee Creek Nation Children and Family Services Administration. Sponsored Representative Crawford.
Chairman, I'd like to make a motion for due pass.
Representative Crawford made a motion for due pass. Is there a second?
Second.
Second by Representative Deer. Discussion. Representative Crawford.
Ms. Carman, would you like to speak on this?
Yes, thank you, Representative Crawford. This grant is an award that we receive every year to support our promoting safe and stable families. So families that interact with our children and family services receive supports to keep the children inside of the home. And so this grant award is one that we continue to receive, and it's non-competitive. Thank you.
Chairman,
Representative Crawford.
I'd like to make a motion to amend the amount on line 28 and 29 from 157,057.33 to 155,796.
Representative Crawford, could you repeat those numbers, the last two numbers, 157, how much?
157.57 and 33 cents.
To what was the number reduced to, please?
155,796.
Even?
Yes.
Representative Crawford's made a motion to amend the dollar amount on line 28 and 29 from $157,057.33 to $155,796. Is there a second?
Second.
Second by Representative Deer. Discussion. Representative Crawford.
Ms. Carman, is that correct with you?
Yes, that is correct. Thank you for that adjustment. And that adjustment came in after we received our federal award, and our initial amount was based off of last year's amount that we had received. So we made that adjustment. Thank you.
Thank you, Chair.
Thank you, Representative Crawford. Thank you, Secretary Carman. Any questions for Secretary Carman from the committee?
I have this is Ann Marshall.
Representative Marshall?
On the positions that you have, are those for current positions that you're supplementing the salary, or is it going to be new positions?
These will be for current positions
Okay,
that
thank
we
you.
currently have. You're welcome. Thank you.
Thank you, Representative Marshall. Any other questions from the committee for Ms. Carman? Any questions from council online for Ms. Carman? Hearing none, roll call vote, please.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings,
Yes.
Anna Marshall.
Yes,
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. Tracy, we need to back up.
That was for the amendment.
Yes, there we go. That was for the amendment. Now, let's go to discussion for the main motion as amended, please. Any discussion from the committee on the main motion as amended? Hearing none, roll call vote, please.
Mary Crawford,
Yes.
Joyce Deer,
Yes.
James Jennings,
Yes.
Anna Marshall.
yes,
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. NCA 21-147, a law of the Muscogee Creek Nation amending NCA 21-097, a law of the Muscogee Creek Nation authorizing expenditure of American Rescue Plan Act, ARPA funds received from the United States Department of Treasury for the Muscogee Creek Nation Citizen Vaccine Incentive. Sponsor is Representative Lowe.
Chairman, I'd like to make a motion of due pass, please. This is Representative McHenry.
Representative McHenry, that has to come from the committee.
Oh, sorry, sir.
Chairman, I'll make a motion for a due pass.
Representative Jennings made a motion for a due pass. Is there a second?
Second.
Second by Representative Deer. Representative McHenry, you do now have the floor.
Yes, sir. From my understanding, this amendment is the age requirement from 12 years old to down to 5 years old to be able to receive the incentive for this.
Thank you, Representative McHenry. Yes, that is, it would be for the vaccine incentive, reducing the age from 12 down to 5. Questions on the committee?
Chairman,
Representative Jennings?
thank you, sir. There's also an amended amount from 80 to 89.
That's correct.
89, 661 is part of the legislation also.
Yes, sir. Committee, you see that?
Yes.
Okay. Representative McHenry? Are you aware of the increase? It would just increase $9,000 to compensate for those citizens in that 7-year age gap?
Yes, sir.
Okay. Thank you, Representative McHenry. Questions from the committee? Hearing none. Questions from council on the line? Hearing none, roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
yes,
Mary Crawford,
Yes.
Joyce Deer.
Yes.
Chairman, you have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. At this time, I'd like to relinquish the chair to Vice Chair Deer.
Thank you, Chair. NCA 21-148, a law of the Muscogee Creek Nation authorizing the expenditure of funds for the benefit of the Muscogee Creek Nation's Youth Services Program for the 2021 U.S. Department of Justice Coordinated Tribal Assistance Purpose Area 9 Grant. Sponsor Lucian Tiger III.
Madam Chair, make a motion for due pass.
We have a motion by Representative Tiger to do pass.
Second.
Second by Representative Jennings. Discussion.
Thank you, Madam Chair. The Muscogee Nation Youth Services Program was awarded the 2021 U.S. Department of Justice Coordinated Tribal Assistance Purpose Area 9 grant in the amount of $508,245,000. And at this time, I'd like to turn the floor over to Ms. Mason. Ms. Mason?
Good afternoon again. We are very excited about this opportunity. We are going to be hosting what is called Restorative Justice Talking Circles. So it'll be a complementary to help out the increased number of juvenile delinquency cases. So young people who have minor offenses can be referred to this program where they will be able to meet with the victim of their crimes and develop a plan to make amends. And so the long term of that is that we hope to then have young people who graduate the program who will then start leading those circles. It will involve life skills classes, volunteer opportunities, cultural arts activities, cultural sports. So lots of things to get young people connected to their culture, to help them to be more resilient and to defer from continued criminal activities.
Thank you, Ms. Mason. Representative Tiger, any other comments or questions? Discussion?
No, Madam Chair, thank you.
Any questions from the committee?
Yes, Ms. Mason, you're going to be hiring one project coordinator to start this Take the Good Road program.
Yes.
And I was just looking at some of the things that you're going to be doing. That's a lot of work for one person. On your budget, does it call for contractual work or anything that would sort of?
It does not. A lot of the services that we list in that grant are things that our program already does. And so it'll be a collaboration of our current staff working with that new coordinator. So the coordinator will primarily be responsible for working with the youth directly and coordinating those circles. But as far as the other activities, like I said, those are things we already do within our program. So it will be just a matter of incorporating those young people into those services.
Okay. Are you going to be doing the talking circles in all the communities, or is it just going to be like a model project where you just go to certain communities, or will you be going to all of the communities to do the talking circles?
So we'll start out small at first, just to make sure that we, get the kind of the model down as to how we want to do things, and then that will be available to other communities. Our hope is that we will have educated people, at least one group in every district, whether that be a school or a community center or a church, on how to utilize the talking circle methods, the restorative justice piece, and so that they can implement those in their own communities as well.
Okay. And so some of your clients that you'll be reaching out to will come through the court system, or will they be just voluntarily coming, or?
It could be a matter of both. So they would have had to had some minor criminal offense, so shoplifting, curfew violations, things like that, where they might just be referred over. So they probably will first have contact with our tribal juvenile justice program, or some of them will. They could make referrals, court systems, schools, other community entities would be able to make referrals to the program.
Okay, thank you.
Thank you, Representative Marshall. Thank you, Ms. Mason. Are there any other questions from the committee? Any questions from council online? If not, roll call vote, please.
Lucian Tiger,
Yes.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford.
Yes.
Madam Chair, you have 4 in favor, 0 against.
4 in favor, 0 against. That legislation has passed. NCA 21-149, a law of the Muscogee Creek Nation authorizing the expenditure of the U.S. Department of Justice 2021 OJJ-DP FY 2021 Delinquency Prevention Grants Program funds for the benefit of the Muscogee Creek Nation Juvenile Justice Program. Sponsor Lucian Tiger III.
Madam Chair, make a motion for a due pass.
We have a motion for due pass by Representative Tiger. Is there a second?
Second.
Second by Representative Marshall. Representative Tiger, you have the floor.
Thank you, Madam Chair. The Juvenile Justice Program was awarded the U.S. Department of Justice OJJ-DP fiscal year 2021 Delinquency Prevention Grant Program funds in the amount of $500,000. This time I'd like to turn the floor over to Ms. Swope. Ms. Swope, are you on the line by chance?
I am, thank you.
Yes, ma'am. Floor is yours.
Thank you. So this is our first year getting this grant. Obviously, as I'm sure all of you know, our program is pretty new and went through a lot of growth this last year. So we're excited to have this opportunity. What I wrote the grant for really is mainly strategic planning. I did wrap up some ideas in there that I'm interested to see if bringing in consultants confirms. One of those is a investigator for our program, a light horse investigator. We've heard a lot of feedback from the investigators that we currently work with that working juvenile cases is really not something that they were trained to do. They really focus more on child protection cases. So I think it's important to bring in somebody with that kind of perspective. We also talked about the need to bring in some interventions for gun violence. We're seeing that in a lot of the cases that come through our program. And so those are some of kind of the initial ideas, but a lot of it will go to bringing in some strategic planners to help us kind of think of what we need to be doing moving forward with the program.
Thank you, Ms. Swope.
Representative Tiger, do you have any more questions, comments?
No, Madam Chair.
Thank you. Any questions from the committee?
Yes, I have one.
Marshall.
Thank you, Chair. Ms. Swope, this is Ann Marshall. I have a question. In your B, in your A, and you got a B. Well, under the B, you're going to develop a strategic plan to establish best practices. But you also say that you're going to be working with external stakeholders. Who would they be?
As far as bringing in the programs or the consultants?
However you meant, where you're providing this cultural competency and implicit bias training to external stakeholders. So my question is, who are your external stakeholders?
We work with a lot of community organizations that help us in a number of ways, whether that is placement for the youthful offenders that we deal with, or whether it is other programs, intervention programs. So we work with some of the youth services in the area that provide what is called a first-time offender program or a 180 program. So they take the kids through kind of different elements as far as correcting their behavior, being able to identify emotions, talking to them about things like substance abuse and things like that. But they don't really bring in any kind of cultural component that's specific to Native children. So we would kind of like to work with them a little bit more to make sure that that curriculum and that information is available to them.
Okay, thank you.
Thank you, Representative Marshall. Any other questions from the committee? Representative Jennings?
Yes, ma'am. My question is the age. What are the ages of the juvenile?
Sure. So we've currently been in the process of updating our internal code here at the tribe. The new code allows us to work with children from the ages of 10 to 18.
10 to 18?
Yes, sir.
Okay. Thank you. Thank you.
Thank you, Representative Jennings. Any other questions from the committee?
Madam Chair.
Yes, Representative Tiger.
Thank you, Madam Chair. Ms. Swope.
Yes, sir.
Section B, line 19. Into the sentence expansion, such as prevention. I think we're missing out. So what type of prevention, correct?
You said prevention?
Yes, it says opportunity for program expansion such as prevention. Prevention.
Prevention, I've seen them come into our program at all. And I think that myself and even Nancy Mason, with the grant that she has had and working with Don Butler and CPS, I think that we're going to look into having a deeper conversation about what types of prevention strategies can be put in place to keep kids from entering into the juvenile justice system. There's a lot of studies that show that children that have been present in CPS for a number of years have a higher likelihood of ending up being a juvenile. So trying to identify some of these kind of high risk populations and intervene so that we don't have to see them coming through our program.
Okay, Thank you, Ms. Swope. Thank you, Madam Chair.
Representative Tiger. Any other questions from the committee? Any questions from council online? Hearing none, roll call vote, please.
Lucian Tiger,
Yes.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Crawford.
Yes.
Madam Chair, you have 4 in favor, 0 against.
4 in favor, 0 against. NCA 21-149 has passed. I will now relinquish the chair back to Chairman Tiger. Thank you, sir.
Thank you, Representative Deere. Next item on the agenda will be other business. We have discussion, Department of Health update, Secretary of Health, Shawn Terry.
Thank you, Chairman. And in order to save time, you guys all have electronic copies of the report. There's a lot of in-depth information from the clinics of Eufaula, Coweta, Mulgee, and the hospitals inside there. I'll give you kind of a general overview of the COVID-19 pandemic. We've seen a little increase in the percentage of COVID positivity of approximately 13% across the jurisdiction over the last month. I think that we've had 2 significant spikes, I think primarily related to Halloween and to Thanksgiving. And the amount of infusions that we've been giving at Council Oak every day, we were averaging about 30, or I'm sorry, in the 20, 25 a day to now where every day we've had to kind of top out at 30 infusions a day. We're also infusing though at the medical center and at Okema as needed. One of the things that I think is encouraging, even though that the amount of COVID is out there, I think that we've seen a decrease in the severity of COVID. We're not seeing people quite as sick. And I think from also on a positive note, there was some announcements from Dr. Fauci today that all the preliminary data is showing that the Omicron virus doesn't seem to be as lethal as what the Alpha and the Delta variant was. But still lots and lots of positivity out there. And I still think we need to keep sending the message that we need to get vaccinated whenever possible, because that leads to significantly reducing your chances of being hospitalized or of mortality. The Department of Health has given 41,621 vaccinations to date. So that's extremely positive. Still very proud of our department on its response to the vaccines, but we will continue to be delivering those boosters and then also rolling out what we're doing with children. I think that we're primarily trying to get a lot of the vaccines to these kids, primarily through our pediatric clinics at Eufaula, Sapulpa, Coweta, and Mulgee. And because we really like having pediatric nurses that is used to giving shots to children who are delivering those, even though they can still get the shots anywhere in our system. The vaccination rate for the Department of Health, we are still at 99% of all of our employees through there. We did have some discussions this week with multiple folks about President Biden's vaccine mandate, and that it was pushed constitutionally by the court system, deemed that the president didn't have the authority to mandate that. And I've been asked, what's the difference if the Supreme Court says that they can't mandate it? And really what the Supreme Court's doing is saying that the president, what they were trying to do was to use Medicare and Medicaid services to punish hospitals and healthcare systems from receiving payment if we did not mandate those vaccines. And so they were going to withhold payment to hospitals, and the court said that they didn't constitutionally couldn't do that. So it really doesn't affect what we did. And so by and large, that ruling doesn't affect us, but there has been a lot of questions on it. If anyone has any questions about vaccine mandates or COVID, I'd be happy to answer at this time before we move on.
Questions from the committee for Secretary Terry? Questions from council online for Secretary Terry? Floor is yours, Secretary Terry.
Thank you, Chair. As we've reported every month for the last several months, that we're getting ready for a go live date on February 5th of the Epic software. That is happening very smoothly. So far, we did have a discussion yesterday with all of our administrators and officers and some of our medical personnel about one of the things that we're going to start trying to do every week is we're going to try to give, well, all of our providers today have about 4 hours a week of administrative time. And we yesterday encouraged them to take about an hour and a half of that time every week to start training our physicians on Epic. Typically in a rollout like that we're going to do on February 5th, you would reduce the amount of provider schedule, you'd reduce their patient load by about 50%. And then the next week you would bump it up a little. And then the third week you would bump it up a little, and then you would go full force. We're going to try to minimize that downtime as much as we can so that we can train through our administrative time every week. And we're hoping that that's going to really create a much more smooth transition as we go. But that's extremely positive and going very well. We have started and initiated the redesign of guest rooms on the second floor of Council Oak for our hospice program that we're going to have here, that our citizens are going to be able to have a place where them and their family can come if they do need those hospice services, and have that room free of charge to be able to assist them while they're here for that. So we're right in the middle of redesign there. We're reviewing the design and site plan for the new emergency room. Hopefully we're going to be able to start preparing to move dirt in Okmulgee in January, and preparing the Okmulgee Medical Center for the new ER renovation. The interior design is here at Council Oak, is working with the architect designers to put some updated finishes and paint and all of that. Even though Council Oak is very nice, it has a lot of nice stuff in it, we're going to just bring it and make it a little more modern with some of the paint and colors that's in the building. The Eufaula Clinic mechanical repairs that we're working with the Streets Mechanical for the repairs of that mechanical system down there. And so that's going on right now. We've got tooling tower repairs here at Council Oak, working with Bernard Engineering to provide the scope of work that we're going to rebuild 2 of the towers. And really these cooling towers here at Council Oak, they're 15 years old. And we just think that we want to start off next year with having really nice heating and air towers when we go here. So we're going to modernize just a little bit there. And the Coweta and the Okemah dental sterilization renovation, we're working with the architect to renovate that space there. So we've got lots and lots of projects. The behavioral health building is almost dried in Okmulgee. And so hopefully we'll be able to start giving some tours of that building as it starts to take shape. If you drive by and look at the outside of it, it looks very nice. And I'll end with that. And I'll be happy to answer any questions before we move on to financials.
Question from committee or council online for Secretary Terry? Floor is yours, Secretary Terry.
All right. Ms. Crawford, are you on the line?
Yes, sir, I am.
If you would you like to go over some of our revenue numbers? Council, I believe that we don't have any expenditures booked right now to report to you for last month, but we are going to give you some yearly totals on where we stood financially. So Ms. Crawford, the floor is yours.
Okay, thank you very much. When we looked at our gross revenue from FY20 to FY21, we had a decrease in the clinics, but it was primarily, well, it was entirely due to moving a lot of our pharmacy from the clinics into the refill center. So when we compared the clinics and the refill pharmacy in Coweta, the year-over-year change was we went down in the clinics almost 25 million, but up 53 million, 53.6 in the refill center. Our hospital revenue was up 7.8 million. So we had a total increase in our gross revenue of 36.6 million for FY20 over FY21. That resulted in collections of on patient accounts of $12 million increase. So we went from 86 million to 98 million. So, of course, the difference in that would be contractual adjustments, things that we write off. But that was a really good increase. We have our October numbers, don't have all of the November numbers. The pharmacy is still on more of a manual process, so they don't have November yet. But our October numbers, when we compare October of 21 or 20 to October of 21, we had an increase of 1.3 million in the clinics and 1.7 in the refill center. So what that tells us is that our clinic services are, we're getting back more in line to a pre-COVID state. Unfortunately, our FY20 and 21 both had a lot of COVID months we had a lot of closures of services, but we're back online, and so it was good to see that increase from October of last year to this year. The hospitals had a $756,000 increase from last year in October to this year, which that's not as much, but we started receiving COVID patients in the hospitals last fall. So that was part of that increase that we had last year. So total increase in revenue from year over year was 3.7 million between the hospitals and clinics. And that resulted in a $3 million increase in collections. So October of last year compared to October this year was a $3 million increase. So right now we're running at about 10 million a month in third-party collections, which we're very pleased about. That's significantly over what we were running last year. I'd be happy to answer any questions. Oh, I wanted to share one other thing. So you may have heard with the COVID funding through through CMS, that there was some funding for uninsured. So if a patient comes into a hospital, either for testing or for being admitted as a patient, no matter what the service is, if it's COVID related, if they have a COVID diagnosis or COVID related, and they do not have any insurance, then we can file those under the uninsured claims with the federal government. Now, it's very cumbersome. There's a lot of steps to take. It takes a lot of time, but so far in FY21, we collected $850,000 as a result of that. So we were pleased with that. Now, if a patient has any insurance and they just don't give it to you, that they send us then the patient's insurance. And so we're required to file that. We can't get uninsured unless the patient does not have any coverage at all. But it's definitely worth the additional effort, and kudos to our revenue cycle group who are doing all the work for that.
Thank you, Ms. Crawford. That is a lot of work, and I'd just like to echo Ms. Crawford's comments. Our billing team does an absolutely phenomenal job on those collections, which, you know, has resulted in almost $1 million there of money that we just wouldn't get if they weren't working it. So congratulations to them. So Chairman, that's our report for the month, and I'll be happy to answer any questions if there are any. If not, that will conclude my report.
Questions from the committee for Secretary Terry? Questions from council online for Secretary Terry? Thank you, Secretary Terry. Next item on the agenda will be announcements. We have any announcements from the committee?
Chairman?
Representative Deere?
Thank you, sir. I just wanted to take a moment, since this is our last regularly scheduled committee meeting for this year. I just wanted to take a moment to thank you for being our chairperson, and for your service to this committee, and also Mr. Jennings, for you both. You've both been good leadership. We're going to miss you. And I just want to say thank you.
Thank you, Representative Deere.
You're welcome.
Thank you. It's been an honor and a privilege to serve with each of you. So good luck.
Thank you both.
My sentiments exactly. You're going to be greatly missed.
Yes.
Well, thank you. And I just want to thank you all for allowing me to be your chairman for HEW. And those of you that were on council with me when I was speaker, thank you for allowing me to be your speaker. And everybody that's on the line, I see Representative Yola Osborne, Representative McHenry was on earlier. Mr. Darnell, it's been a pleasure working with all of you. Ms. Beaver, Secretary Terry, whoever's still on the line, if they're still on. Everyone that's on the line, all the committees, the cabinet members, it's been not just an honor, it's been a privilege to serve as a council representative, represent our nation. And I just want to thank you all for your support throughout the years. It's been a great time. I've really had a experience that I'll never be able to forget the last 8 years. So thank you all very much for all of your support and everything, and continue to work hard and continue to push our nation forward. Thank you all. Any other announcements or comments? Hearing none, entertain a motion to adjourn.
So moved.
Representative Marshall made a motion to adjourn.
Second.
Second by Representative Deere. All in favor say aye.
Aye.
All opposed, same sign. I'd like to ask Representative Jennings to please give the benediction.
Let us pray. Gracious Heavenly Father, we come to you in prayer this afternoon, asking for your continued guidance and direction as we go forward with the remainder of our terms. Father, we ask that you would bless each and every one that are on the council. Father, we ask that you would continue to bless the nation. Father, we ask that you would continue to watch over our service men and women, wherever they may be this holiday season. Father, we ask all things in Jesus' name. Amen.
Amen.
Meeting adjourned 2:28.